Hey everyone, Wayne Unger back for the next episode of our Election 2020 series where we discuss the issues ahead of the November 3rd election. Today's conversation is going to be about healthcare, specifically the executive orders that Donald Trump signed yesterday and how they basically do nothing. So, first and foremost, the Affordable Care Act is also known as Obamacare. That was signed into law about 10 years ago, 2010, I believe. Trump signed executive orders yesterday and he calls them the America First Healthcare Plan, in which we will have better care with more choice at a much lower cost and working to ensure access. While I looked at all the details, both of the Affordable Care Act as well as the Trump executive orders from yesterday, and the executive orders do nothing of the sort. It is more hypocrisy from the Republicans, and so let me explain. Donald Trump says his plan will expand affordable health insurance options, reduce the price of prescription drugs, protect Medicare, protect patients with pre-existing medical conditions. They say they are going to do all these things, yet they argue in court, which they are today, that they want to do the opposite. So this is the definition of hypocrisy. Trump claims, regarding the Democrats' plan ahead of the 2020 election, Trump claims that it will ration care, deny choice, implement wait lists, drive the best doctors out of medicine, and delay cures. Well, the reality is, for the last 10 years since the signing of the Affordable Care Act, we've, quote unquote, lived under a more democratic healthcare plan. And we've seen none of those things. We've never seen rationing of care. We haven't seen delaying of cures, right? All of these things, if you want to say have happened during the pandemic, right? We've rationed care a little bit, specifically medical testing for the COVID-19. But then you argue, is that because of the Affordable Care Act, or is that because of the federal administration, the Trump administration's poor management of the pandemic? I argue it's the latter. Moreover, here are the facts about the Affordable Care Act, despite whatever the right says. So number one, the Affordable Care Act greatly expanded healthcare coverage. 20 million people are now insured under Obamacare than they were before the Affordable Care Act was enacted. Now keep in mind, the number of uninsured or underinsured have ticked up during the Trump administration since he took office. Now, this is likely because of one of two reasons. Number one, he cut the marketing budget to the Affordable Care Act, meaning less people are aware on that, one, they have marketplace options, and two, how to sign up for them. But the second reason why this has possibly ticked up is the Republicans repealed the individual mandate, which was the tax, according to Chief Justice John Roberts, at a case that the Supreme Court held several years ago, that the individual mandate was essentially a government tax on persons who did not have health insurance. Say, hey, if you don't have health insurance, we're going to tax you. Furthermore, the Affordable Care Act expanded Medicaid in all but 14 states. And the states that did expand their Medicaid were led by both Republicans as well as Democrats. So despite the GOP arguing against Obamacare and how horrific it is, the Republicans also used it to expand healthcare access within their own states. Lastly, we do know that the Affordable Care Act led to higher deductibles, but the Democrats have admitted to the weaknesses of the Affordable Care Act. They've said, hey, let's fix the deductible situation, but that doesn't justify the repeal of the entire act and all the other protections, all the other good stuff that are in the act. So the GOP killed the individual mandate, as I previously called. Now, this has led to another lawsuit against the Affordable Care Act, this time led by Republican attorneys general, in which Trump has said the Trump administration is joining. And so this case will go before the Supreme Court, and they are seeking to strike down the entire law now that the individual mandate has been removed, which was the basis for its constitutionality in the past. Here's the effect if this happens. So number one, 20 million-ish people will lose healthcare coverage if the court strikes it down. Number two, pre-existing medical conditions, that protection would go away as well because that's protected under the Affordable Care Act. So if you strike down the entire law, then you also strike down the protections for pre-existing medical conditions. Now, Trump, like I said, has argued, hey, our opponents, he said this yesterday, Our opponents, the Democrats, likely like to constantly talk about it in reference to pre-existing medical conditions. And he said, and yet pre-existing medical conditions are much safer with us, the Republicans, than they are with them. And anything of the sort in which the Dems say is disinformation. He said those words yesterday during his announcement. You are literally in court to argue to strike down the Affordable Care Act. And with that striking it down, you remove the protections for people with pre-existing medical conditions. You cannot say that pre-existing medical conditions are better protected by the Republicans than the Democrats when you're literally in court arguing against it. That is the definition of hypocrisy. Lastly, he also said he would protect Medicare. And to the seniors who are watching, he said, quote, as long as I am president, no one will lay a hand on your Medicare. But several weeks ago, President Trump also said that he would seek in his second term to repeal the tax that funds entitlement programs such as Social Security and Medicare. That doesn't make sense. I'm going to repeal the revenue stream for entitlement programs, yet I'm going to protect the entitlement programs. You can't have it both ways, President Trump. Lastly, given the pandemic, let's look at the Democrats' plan. The Democrats have argued for an expansion of public provided health insurance, that is Medicare, Medicaid, marketplaces, etc. In a system in our country where employers provide health insurance, and private health insurance. With the pandemic and historic highs of unemployment, so I believe we're at 8.4% today, in an employer-provided healthcare system, this means people go without insurance. This means people go without the necessary health protections that they need when a virus and the disease COVID-19 are killing thousands of people in this country and millions of people around the world. So the Democrats say, hey, we need a public option. We need to expand the public option because people are unemployed to no fault of their own, or they're underemployed to no fault of their own. And in a pandemic, people need healthcare coverage. It is just that simple, ladies and gentlemen. If you have any questions, feel free to hit me up. Until next time, I'll talk to you later.